30% of the general population may just be suffering from one sexual problem or the other. It's a silent pandemic and something that most people just do not know who to address, where to ask these questions, and which answers will actually be of help. I am your host on your show today, Dr. Lauren Mengesa, yani Daktari wa kina mama, and I'm an obstetrician and gynecologist. I practice at the Nairobi Hospital and at Akira Care. Now, on this show today, I have a professor of sexual and reproductive health to guide us on this very interesting conversation. His name is Professor Joachim Osur. Karibu sana, Daktari.
Thank you very much.
Now, Professor is not only a guru on matters sexual health, but he's also the Vice Chancellor of the AMREF International University. He's an obstetrician and gynecologist by training, but he has chosen to be the voice of reason and of solace for those people who are struggling with matters sexual health. Now, as we start this conversation, please remember to engage us on our numbers down below on 22422 for our SMS lines. Talk to us on our socials at Uliza Daktari and at Daktari_Mengesa. Daktari, karibu sana.
Thank you.
Najua watu wengi hawajawahi sikia kuna professor wa mambo ya reproductive health and sexual health. What exactly do you do in this field? Which kind of patients look for you or come to see you?
Yeah, actually, I know people know gynecologists. I'm a sexual medicine practitioner. It is different from gynecology, and it's also different from urology. No. Watu wengi wanajua daktari wa kuzalisha, daktari wa urology. Those ones they know. But sexual medicine is a neglected area. No. In fact, I think currently I'm the only doctor who has done it. It looks at sexual problems that people face. Kuna wale either wamezaliwa hivyo au along the way as they grow, they have problems that make them not able to practice their sexuality. Sex may fail in Kiswahili. So the patients I deal with when it comes to clinical work ni wale ambao wako na shida ya to do sex, to have sex with their partners. Yeah. So that whole area of repairing sexual dysfunction, hiyo ndio tunaita sexual medicine. Yeah.
So tukisema sexual health, what are we referring to? Hii neno inamaanisha nini? What is sexual health?
Yeah, sexual health as defined by WHO is a state of well-being in all matters sex. Whether it is sexual thoughts, sexual practices, sexual values, you should feel comfortable and you should feel good about what you're going through, about your thoughts that are sexual, about your practices that are sexual. And so because sex is very engraved in values, your values should match your practices. And you should also biologically be able to have sex the way it should happen, in a satisfying way for you and your partner. So sexual health is when you're comfortable in all those areas. You feel good, you feel proud, you feel your ego is not crushed because of your sexual thoughts, sexual practices, sexual experiences. Yeah.
Tukifika kuangazia mambo ya kujamiana, najua watu wengi saizi washaingia mvunguni mwa kitanda, manake people are embarrassed to talk about these topics. We have been on holiday actually, fast approaching December. We know our kids are at home. Kuna mambo mengi sana kwenye mtandao kuhusu mambo ya kujamiana, about sexual health. Kuna mambo ambazo ni za sahihi, mengine ni makosa. So why is this the time? Why is it important kwa sisi kwanza kuzungumza kuhusu mambo haya?
Yeah. This period when we have school holidays is a very critical time.
No.
When you practice medicine, whether we're a gynecologist or any medical person knows that in January and February we deal with a lot of unwanted pregnancies, infections, school dropouts, early marriages, because of the things which happen when people are on holiday. There are no parents who are comfortable talking to their children about sex. If they are there, they are very few. Kwa hivyo, young people, vijana, wanajitafutia suluhisho.
Yeah.
You know, it is normal to have sexual feelings. And when you are an adolescent, those feelings are very strong. They are very strong, to the extent that you can even disown your parents and elope with someone. And that is normal. Shida yenye tuko nayo ni kwamba we have not created an environment where when young people have those feelings, they can easily talk to a parent and be given audience and not be frowned at and not be judged. And so when they have those feelings, they go to their friends, they go to the internet, they try to practice what their body is pushing them to do, and because they don't have adequate knowledge, they're just starting to have these feelings. Sometimes they end up with problems. It is estimated in Kenya that 15 out of 100 young people aged 15 to 19 will get pregnant every year. So these are people mostly in secondary school. And in some counties, that figure is much higher. It even goes in some counties to like 30–40% of young people getting unwanted pregnancies. As we talk now, HIV rates have been going down, generally. But when you look at the adolescent girl, the rates are still going up. And it is because those natural feelings are accompanied by unsafe sexual practices, because we have neglected to talk about sexuality to these young people. The holidays provide a fertile ground for infections to happen, for unwanted pregnancies to happen, and for people even to elope and get married early. And these are tragedies because they affect the rest of someone's life.
Daktari, you have traveled the world learning about sexual health. Hii shida ni yetu tu kama Afrika, or is this a challenge ambayo tunaona kila mahali duniani? Na what are some of the common problems ambazo unapatana nazo on the day to day when it comes to sexual health, na ni changamoto zipi ambazo watu wengi wanakuja nazo kwako?
Well, generally across the world, at any given time, like you said, about 30% of the population will have something worrying them about their sexuality. And this is across all ages. So if Kenya has a population of about 55 million, those are over 15 million people we are talking about in any given day worried about their sexuality. Some are young, some are old.
Tuna simu? Hello, Elizabeth?
Hello.
Karibu Uliza Daktari.
Hi.
Swali lako Elizabeth.
Hello.
Hello, swali lako.
Nilikuwa sikiza. Kwa ndoa.
Naam.
Alafu pia nimeoa. Yaani nimelewa pati zile vitu zenye napitia zimefanya yangu imerudi.
Elizabeth, hatukupati. Hello.
Hello, nasema. Nimekuwa kwa ndoa, but sasa zile vitu zenye napitia zimefanya libido yangu inaenda chini. Yaani sina hivi niyo mtu, yaani hata moja nitafii yoyote.
Miaka ngapi unazo Elizabeth?
Niko na 27.
Okay, na ndoa imekaa miaka ngapi?
Miaka 7.
Asante. Naam, Elizabeth is talking about libido. I think tutakuja kwa hayo, maana nimekuuliza what are the common issues that you encounter. Naam.
In fact, ni vizuri Elizabeth amepiga simu. Low libido is the commonest sexual problem among women. Kupoteza hamu at all ages and for different reasons. Earlier in, like now, her age, most of the time is a problem of relationships.
No.
When you lose that emotional connection to your partner, many women, the first thing that goes is sexual desire. And we have a lot of those relationship problems, and so at an early age, a lot of women lose sexual desire, sexual interest. They just don't want it. But as they go towards menopause, then biological problems come in. Hormones, you know, female hormones go down, and that goes with sexual feelings as well. So normally, like in Elizabeth's case, we would like to assess fully how the relationship is doing, her own lifestyle. Another thing is that when someone is really facing stress from whatever cause, sexual feelings go. So her lifestyle, her job, what is going on in her life. We would also normally check hormones, because even at her age, hormones can have derangements before we arrive at what is the cause. Halafu sasa kutibu itategemea ni nini inaleta hiyo kupoteza hamu.
Daktari, kama daktari kina mama, mara mingi baada ya wagonjwa wangu kujifungua, some of them will come back and tell you wanasikia uchungu. Wengine watasema they are not sure. Unajua baada, especially kwa wale wamejifungua kwa njia ya kawaida, hawako sure kama hali iko vile ilikuwa hapo awali. Some people argue that the biggest sex organ is the brain. So hii ni kwa wanawake peke yake ama ni wanawake na wanaume? Na hizi tatizo zingine kama uchungu, infection, zinachangiaje kwa mambo haya ya libido ama hamu ya kujamiana?
In sexual medicine, we say that the whole body is a sex organ. You know, someone you love, if any part of the body they touch, you feel some electric current. So you respond accordingly. After delivery, a lot of things happen. Other than the physical damage that happens in the system as the baby comes out, there are also changes in hormones. As people breastfeed, you know, the hormone we call prolactin goes up. Also, the lifestyle generally changes. The baby begins to cry at night. You can't sleep. There's a lot of exhaustion. So all these things bring down libido. But also the damage that happens and the stitching around that area, the female sex organ, takes time to heal. So if people start too early, they start to get pain. So they don't have interest, there may be pain, they are exhausted, so they just don't want to concentrate on that. The baby is crying. And many times people want to keep the baby on the same bed they are sleeping, and I tell them, you will take a longer time to go back to your normal life. As soon as you can, maybe within the first 1 week, 1 month, let the baby be on the baby cot. So that
I'm sure we're going to have so many reactions to that, Daktari.
Yes.
So before we continue, please talk to us. We're here to answer your questions today. Speak to us openly. Hakuna swali ambalo linaleta aibu, tutajibu zote kwa show leo. So please talk to us on our SMS lines, and we'll be back after the break to answer all your questions on matters sexual health. And welcome back. So we're going to get right into your questions. Sawa, Daktari, mimi sina hisia hata kidogo. Na mke wangu hata kijaribu inakataa kabisa. So this is, okay, he's not giving us his name. Chris, who is 35 years old, says he's having a problem achieving an erection when he's with the woman he's intending to marry. Lakini akiwa na wengine, anasema yuko sawa tu. Mwingine anasema kama mtu anataka sex but my body is not interested at all, naweza fanya nini? Haya, mwingine anasema hi Daktari, I am 23 years old, I'm married, I have a problem. She experiences pain on the cervix during sex. Mwingine anasema baadaye huwa anawashwa sehemu ya chini ya tumbo na akikojoa anasikia uchungu sana. Last question, my husband comes, I think he travels, he comes once a year. What can happen if you stay for long without having sex? Is it going to affect your body?
Those are very many questions. But I've had some questions that concern men. I've had a question there around erection failure.
Libido.
Libido, yes.
Yeah.
But because we've talked a lot about women so far, for men, the commonest sexual problem is erectile dysfunction. The erection fails.
Daktari, tutachukua simu alafu turejee pale.
Okay.
Naam, hello.
Hello.
Hello, karibu Uliza daktari.
Nilikuwa nauliza hivi. Mimi nimeishi na mzee wangu 7 years. Tumekuwa mzuri kwa ndoa.
Naam.
But amefika mahali ani nguvu imeisha. Kwa hiyo hali ya kufanya hiyo tendo la ndoa. But yani hali yake anasimamisha, but kwenda hana nguvu. Hiyo ni shida gani?
Umesema amekuwa kwa ndoa kwa miaka ngapi?
7 years.
7 years, asante. Sawa sawa. Mwingine anasema hapa, hi, I'm Eve from Nakuru. I've been in a marriage for 6 years, but when it is time, his penis drops down and he can't do anything.
Yeah, so the question asked, all these are erection failure.
No.
Commonest male problem in sex, erection failure. There are many, many causes.
No.
Currently, the commonest is what we call lifestyle diseases, which affects all age groups. As simple as not sleeping enough can cause erection problems. Stress at work can cause it. Someone there has asked when she's with a woman she wants to marry, the erection goes. We call it situational erectile dysfunction. It's erectile dysfunction which only happens with one person and does not happen with others. And it's very common in marriage. And commonly it happens when there is some hard feelings in the relationship between the two people. So either you feel betrayed or there is just something you are not connecting with the person. So you will have no issues with other people, but with this one person, things will not happen. Those are people who need therapy for them to reconnect emotionally. But generally, when it comes to erection failure, a good assessment is important. It could be the lifestyle issues, it could be a very serious medical problem. Remember, diabetes, for example, hypertension, high cholesterol, all these things. The first symptom you may have is erection problems. A number of men also, low testosterone, the hormone that makes us men. When it goes down to a certain level, things fail. And then there are other hormones which we are not supposed to be having, rising in us. They are more in women, like prolactin, which is common in women during breastfeeding. When it is high in a man, the erection goes. So normally we say that a failed erection may be a sex problem, maybe a social problem, maybe a relationship problem, maybe a biological problem, and a full assessment and a number of tests helps us to identify the cause, and then we treat that cause.
Naam, tuna simu. Hello.
Hello.
Moses, habari ya dala?
Niko salama, kiko freshi.
Aha, tupe swali.
Sasa niko na shida. Mlingoti wangu ukiwa katika maeneo ya kazi. Baada ya kulilisi bado unasimama kwa muda mrefu.
Naam.
Hello?
Naam, nakusikiza.
Alafu nahisi uchungu kwa ndani. Hello?
Naam. Aha.
Nahisi uchungu. Baada ya kulilisi.
Sawa.
Anahisi uchungu baada ya?
Daktari anauliza unahisi uchungu baadaye ama wakati uko katika kitendo cha kujamiana?
After nimelilisi.
After.
Baadaye.
Mama, alafu mlingoti unahisi uchungu.
Okay.
Naam, tumesikia swali lako, asante.
Yeah.
Okay.
Yeah, for men the commonest cause of pain is infection. Pain is a common sex problem. mostly in women. But if it happens in a man, we want to be sure that there is no infection, because that is the commonest. But some people also, you know, in this kujamiana kuna watu wawili.
No.
So assume also that there is a problem with lubrication. Sometimes men get bruised in the process and they can have pain after. So we would also want to assess if that dynamic is okay. But for women, pain is the second commonest. We say low libido.
So libido first, then pain.
Pain next. And pain commonly for most women is lack of lubrication. The severest form is muscle spasms. We call it vaginismus. Muscles za hapo zimekataa.
Zinakataa kurelax.
Kurelax. Na when they contract, unasikia uchungu mbaya sana. Until penetrative sex is impossible. So that is very common also. Infection is still an issue for women, and they can get pain. So,
Daktari, tuna simu?
Okay.
Hello.
Hello.
Hello, karibu Uliza daktari.
Habari.
Salama, swali lako.
Swali langu ni, mimi naitwa Benedict kutoka Kisii. Swali langu ni
Naam.
The year 2006 nilikuwa nasikia uchungu kwa miguu. Nikachomwa sindano.
Benedict, tafadhali punguza sauti ya runinga.
Ilipofika
Sawa, wacha tumalizie swali tulikuwa nayo uchungu.
Yes. Yeah, so pain, uchungu wakati wa kitendo cha ndoa is not normal. Kuna watu ambao wamesikia uchungu kwa muda mrefu mpaka wanasema
wanaona kama ni kawaida.
Hiyo mimi huwa hivyo. Hiyo sio normal. So ni vizuri mtu aende hospitali. Kwa maana shida ingine tuko nayo ni kwamba watu wanafikiria ya kwamba hizi shida za bedroom sio za kutibiwa hospitali.
Naam.
So unasikia uchungu, erection imefail, sijui hakuna hamu ya hiyo kitendo, low libido na kadhalika, na hutaki kwenda hospitali. Unafikiria hiyo ni shida ambayo sio ya kutibiwa hospitali.
So ni shida kama shida nyingine yote, kama ugonjwa wa sukari, kama malaria, unahitaji kuonekana na daktari.
Very true.
Naam.
Very, very true. So mtu akuje hospitali, kwa maana mara nyingi watu wanaenda kwa mitishamba. Si ati mitishamba ni mbaya. Lakini mimi sijasomea hiyo. So labda inafanya, that's okay. But pia hospitali ni muhimu kwa hii mambo. Na mara nyingi we discover very big diseases out of a sexual symptom. So unaweza kuwa na shida kubwa ambayo inaendelea kuenea kwa mwili, and because you are not going to hospital because it is manifesting sexually, it ends up being a very big problem. We have diagnosed prostate cancer advanced after someone has had very many problems sexually over time without going for treatment. Yeah.
Naam. So tunaswali hapa inasema, if your sexual feelings are high, how can you control it to prevent early pregnancy in teenage time? Mwingine anasema jinake ni Valerie, why is sex painful? Na mwingine anasema daktari, what is the problem with masturbation? Tutaangazia maswali haya na mengine mengi after the break, so please stay tuned and don't touch the dial. When we look at the statistics of our children between the ages of 15 and 24, we see that about 10% are having their sexual debuts before the age of 16. Rural areas being more affected than urban areas. When we look at places like Kisumu, about 50% of these young people are actually having their first encounters before the age of 15. Now, Daktari, the school holidays are here. Our children are at home, and some of them are actually engaging in these sexual practices without any knowledge, without any preparedness. Some of them are going to be victims of teenage pregnancies, infections, and sometimes even more harmful things like procuring abortions backstreet if we don't have these conversations. So how do we start talking to our young people. This is Africa. We know how our context is. Tutaanza aje kuzungumza na hawa vijana wetu ili tuweze kuwatayarisha vizuri. Not to encourage them, but to teach them so that they can step into these spaces ready.
Yeah. So, you know, before our traditional systems broke down, we had a very good way of doing this. In many communities, it used to be the grandparents or the uncles or aunties who would sit with a person and tell them about their sexuality and what to expect and how to manage those feelings. And not just the negative, they would even tell them the positive things, how to be sexual at the right time and all that. Now, those traditional systems kind of failed. They have gone, they have faded off. In an ideal world, we would then have a national system of doing it, which in many countries we call age-appropriate sexuality education. Age-appropriate sexuality education is very controversial because some people feel that if you give people, young people knowledge about their sexuality, they can misuse it by having sex. Now, what people don't know is that there are a number of avenues right now of people getting information on sexuality. Some are good, others are not good. So because we don't have a controlled way of building capacity around sexuality for young people, they will go to the internet. They will learn from it, all the bad and the good things. They will go to their peers and ask. So two people who don't have adequate knowledge will advise each other. And normally it is, I have a boyfriend or I have a girlfriend, do you have? If you don't have, then something is wrong with you. So you also look for one. That's the kind of peer advice we get from each other. And because of the current situation, and parents find it very difficult talking to their children about sex. Some avoid it. Some just become harsh. For example, if you had a girl child, maybe we've talked about before the age of 16, they're already having sex. But assume you get your 14-year-old with a condom inside their school bag. What do? Most parents will beat you up. Or they will take you to the pastor to pray for you. Or they will curse you. There will be a negative vibe. They can even disown you because you're carrying a condom. Now, remember, the young person has this hormonal push, which is natural. And in fact, if you don't have it, you should go to hospital for treatment. Because when you go into adolescence, when you start developing those sexual, physical features, you also start to feel like having sex. That is normal. It is expected. So those feelings are there. You're getting advice from everywhere. So some people then start to be sexual. They hide it from their parents because if you go to your parent, you know the consequences. So they don't talk to the parents. They do it the way they know. Now, when you start fighting a young person because you found a condom, what message are you passing? Don't use a condom. Then they end up doing it without. And many times, because we've not developed trust with these young people from an early age, you cannot then start advising them when they're the age of 15 on things that you've never talked about from the time they were young. Now you want to advise them at this point. They will not trust you. And in fact, it becomes a very emotional conversation. People shout at each other, and it ends badly. So young people are in a very vulnerable situation. No support from the family, no national curriculum for sexuality education. When we go to our religious, I'm a Christian, so when I go to church, you know what we are taught. There is the right time to have sex. If you're having it now, it is sinful. And that's it. So we don't have mentors for young people. We don't have people they can talk to openly about their feelings and be accommodated. Nobody tells them that it is normal to have those feelings. If you don't have them, you are abnormal. So they feel confused. They choose what they think is best for that time, and sometimes it ends up badly. That is the crisis we have. And if we are not careful, just like we said at the beginning, in January, we will be treating unwanted pregnancy. We will be treating HIV infection. Mm-hmm. Some people will have married off.
So, Daktari, how? The question the people who are paying attention want to know, how do you start this conversation? You've made a very good point. We have to start it early. Not when they're already teenagers. How early? And how do you slowly start to introduce this content so that as they grow older, you can have more, get into the more complicated areas of this discussion? Yeah,
start creating trust on this subject early if you're a parent. And early is as early as when people start noticing their body.
They're boys and girls.
Yeah, they're boys, they're girls, and they start asking questions about it. Be open and talk about it. You know, a young boy, 5 years, wakes up, they have an erection. Explain to them what it is. It is normal. Start to converse about private parts very openly, so that at the time when they start to have feelings, you've already told them, and this is very, for menstruation, some parents do it very well. They say, oh, you can actually have periods. So prepare for it, I'll buy you pads, you can carry to school. We should also be saying, at the age of around 10, 12, 13, 14, you will start having sexual feelings. When you touch your body, you will feel something good. You will want to engage with someone sexually. Those feelings are normal. And we will be telling them how to manage that. And this, there is no clear answer to this, but come and tell me what you're feeling. When people approach you, come we discuss. When you want to approach someone, come we discuss, so that we manage it in a safe way. But don't tell young people it is evil to have those feelings. You're a bad girl, you're a bad boy, you're feeling like having sex, you're too young. I'm taking you to school and you're just thinking about sex. We are destroying them. They need to know it is normal, and they need to know how to manage it. If you can't talk to them about it, is there someone else that they are close to, they trust, whom they can talk to? It could be an uncle, though these days it's hard. It could be a friend, family friend, who can openly talk to them about it. Let's give them opportunity to talk about those feelings. Let's not stigmatize normal things. Yeah.
Thank you very much, Daktari, for starting us on this very essential conversation. So we're reaching out to parents. We are talking to all those people who are responsible for these young lives that we're trying to nurture. These conversations will start as soon as your child begins to know they're a boy, they're a girl. We start talking from the age of 4 years, 5 years, teaching them what is wrong, what is right, but also not making them ashamed of who they are. So let's keep talking, let's keep having these conversations, even on our socials. Keep sending us your questions and thoughts on this topic. And as we close, thank you for joining us tonight, and see you again next week on Uliza Daktari, same time, Sunday at 8 p.m.